Picture this. You're cooking dinner. Your phone buzzes. Results available. You open the portal and see a column of numbers and little abbreviations. Your heart quickens because none of it looks familiar. I've had patients call, voice shaking, asking whether a single number means the worst. It doesn't have to feel like that.
Welcome. I'm Jess, a family nurse practitioner and legal nurse consultant. This is the space where healthcare, law, and real-life situations intersect. And today, we're turning those numbers into useful information you can actually use at home or in a clinic visit. By the time we finish, you'll have 3 practical skills: a simple map of common labs, how to spot when a single abnormal result matters versus when trends matter, and exact words to use when you call your clinician. I'll also give tracking tips and quick red flag numbers to watch for, with the important reminder that ranges vary by lab. First, a short primer. Labs are ordered for screening, diagnosis, monitoring treatment, or checking safety. The sample might be blood, urine, or something else. One key: units and reference ranges matter. A number without units is almost meaningless. Reference ranges usually reflect where 95% of healthy people fall. They're not an absolute pass or fail.
Why do ranges differ? Different lab machines, different populations, even different calibrations. So a value flagged high at one lab can be only marginally above the cutoff at another. Context, symptoms, meds, and trends is what turns a number into action. Let's break down common panels in everyday language. First, the CBC, the complete blood count. Think of it as a snapshot of the cells in your blood. Hemoglobin and hematocrit tell us about red blood cells and oxygen carrying capacity. Low hemoglobin can explain fatigue and shortness of breath. White blood cells rise with infection or inflammation. Platelets help clot. Very low platelets increase bleeding risk. Next, the basic metabolic panel, BMP or Chem7. This gives electrolytes like sodium and potassium, plus kidney markers like BUN and creatinine, and glucose. These tell us about hydration, kidney function, and immediate metabolic states. For example, dehydration can raise BUN and creatinine. Some blood pressure medicines or anti-inflammatories can change these numbers too. Liver tests, AST and ALT, alkaline phosphatase, bilirubin, point to liver cell injury or bile flow problems. Mild bumps often come from fatty liver, meds, or a recent drink. Very large spikes suggest acute injury. Lipid panels measure cholesterol and triglycerides for long-term heart risk, not an emergency. A1C shows average blood sugar over 2 to 3 months. Thyroid tests, TSH, free T4, tell us whether the thyroid is under or overactive. CRP and ESR are inflammatory markers. They say inflammation is present, but not why. Okay, how do you read results so you don't panic? Focus on patterns, not single points, unless the number is in a dangerous range. A slightly high white blood cell count with no fever, we often watch. A creatinine rise of 0.3 milligrams per deciliter from your baseline over a day or two, that's significant and we pay attention. Trends, especially steady increases or decreases, tell a much stronger story than an isolated blip.
You asked for numbers. Here are red flag thresholds with immediate actions. Potassium above about 6.0 millimoles per liter can affect heart rhythm. If you have weakness, palpitations, or chest symptoms, call immediately or go to the ER. Sodium below roughly 125 millimoles per liter can cause confusion or seizures. Seek urgent care. Hemoglobin under about 7 grams per deciliter, or a rapid drop of 2 grams per deciliter with dizziness or fainting, needs urgent evaluation. And if creatinine jumps quickly from baseline, for example by 0.3 milligrams per deciliter in 48 hours, call your clinician. These are examples. Labs and clinical context vary, so treat these as clear signals to get help, not as the only rules.
But Jess, what if I feel fine and the number is off? That's a great question. Feeling well doesn't always mean everything is fine, and feeling unwell doesn't always line up immediately with numbers. If the number is mildly abnormal and you have no new symptoms, we usually repeat or track before drastic changes. If you have symptoms that match the abnormal test, act sooner.
Remember temporary factors that skew results. Dehydration concentrates blood. Recent heavy exercise can raise muscle enzymes or even liver tests. Steroids raise blood sugar, and not fasting will change a lipid panel. Note these details when you review results or call your clinic. They change interpretation. Here are exact, copyable scripts for your messages. For urgent concern. Hi, this is your name. My lab shows test equals value with units, and I have symptoms. Is this urgent? For clarification, can you confirm the units and reference range for this test and how it compares to my last result? For tracking, can you add my prior results to the chart or send a trend report? Be specific. Name the test, give the number and units, and say how you feel. Organization is simple but powerful. Make a phone photo album or folder called Lab Results. Save PDFs from your portal. In a spreadsheet, track date, lab, test, value, units, and symptoms. When you see a clinician, a quick trend line beats memory every time.
I know the internet is tempting. Type a test name into search and the worst case headline shows up. The internet loves extremes. Use reputable sources and remember headlines don't know your medication list or symptoms. Bring questions, not panic, to your clinician.
What if a result looks impossible, like a sodium of 160 with no symptoms? Ask about sample issues. Was the sample hemolyzed, mislabeled, or diluted? Labs sometimes request repeats. That's standard practice when results are surprising, and it's a responsible step, not a mistake to be afraid of. A small real-world habit I recommend: when you get results, screenshot the page immediately with the date and time on your phone. Add a one-line note about how you felt that day: tired, dizzy, or fine. Over months, that one line plus the numbers becomes gold for your clinician. Before we close, 3 concrete actions to use today. 1. Don't overreact to a single number. Check symptoms and trends. 2. Save and track your results in one place and note meds, fasting status, and symptoms. 3. Use the scripts I gave when you contact your clinic so answers are faster and more useful.
If this episode helped you feel a little less intimidated by lab numbers, I'm glad. This is general education, not personalized medical advice. So if you have new or worsening symptoms, call your clinic or go to the ER. If you want printable scripts or a one-page lab tracker, head to FAQbynursejessicaconsulting.com. If this episode was useful, please subscribe so future episodes can find the people who need them. Share with a friend who panics at portal pings. And if you need detailed help interpreting complex results in a medical legal context, you can learn more on the website. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases.
You can learn more or schedule a consultation at FAQbynursejessicaconsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.